Hi, I'm Mark Paul from Living for Hope, and thank you for being here. I help and teach people recently diagnosed with cancer, faced their difficult and new life-altering circumstance, so that they can find a hope to live fully and thrive in their new normal. And today I want to talk to you about something that really speaks to my mission at Living for Hope. It's an article I just recently read in Time magazine. It's called The Forgotten Side of Cancer Care. The Forgotten Side of Cancer Care. And it was an issue of November 7th, 2016. It's written by Alice Park. So Alice interviewed doctors at some of the prominent cancer hospitals, and she found that there's a new, a forgotten side of cancer. Cancer primarily has been dealing with how do we get rid of the cancer. So they focus on the chemo, the radiation, and the surgery. But there's more to that. This focus on the core problem of the cancer is not focusing on the core of the person, the patient themselves, so what they're going through. And there are many factors additional to just the cancer that someone has to deal with in this new normal. And so she talks about those things. She talks those things which could be the social support, your financial support, and also your kind of your spiritual set, your mindset, your diet and exercise, and all those things have a great deal of importance to your recovery. And here at my mission at Living for Hope is simple. I want you to live fully, and the way that I've had the chance to live fully after my cancer, or during my cancer, I'm actually still going through treatment, but the way I'm able to do it is through making sure I address the 4 points of my framework, which is my mindset, my body, my support, and my spirituality. All those 4 components. I think if I get those into balance, then I get to live fully. And for me, living fully just means to participate in all the things that I love to do. Spend more time with my family, go traveling, go cooking, enjoying wonderful wines. To live life to its fullest, and to be with my friends and so forth. So it's important that we don't ignore the other aspects of our care. And what Alice found in this article is that, for example, she interviewed this person called Ann Cor. Let me not butcher her name, but Ann Corsarelli. She's a founder of Simsman Center, which I've actually been there myself. It's a great place. They offer great care. But Ann says that for every physical effect of cancer treatment, there's an equal psychological effect. Have you ever have a lot of anxiety, or possibly even faced depression since this happened to you? Or you feel lonely at times, that you feel that your body image is truly affected. There's a lot of different aspects of what we're going through, which, are the oncologists and, our surgeons don't really think about. But all these other components make us. So it's really important to address those. And it's like, what else is also said in this report is that there is a recognition of that this needs to happen. And they call this emerging field psychosocial oncology, which is fantastic because, I've always believed that it's not just the treatment, there's so much more. So this psychosocial oncology, I think, is great news. Now, not every hospital is doing that, but some hospitals are doing so. I know that UCLA is getting involved in that area, and the Mayo Clinic, and there might be others. So hopefully you yourself are in a place that actually also values the additional aspects of your care. And if not, then make sure to follow me, because this is what my mission is to introduce you to all those other sides of our care. So one thing we do know, and she says this in her article, she says social support can help patients cope with painful treatment regimens. I've gone through surgery and chemo and radiation for a year straight, and I know how tough it was. But my social network really helped me get through this. Also, she says also studies show that social support, mindfulness, meditation, and exercise, among other holistic strategies, can reduce depression associated with cancer. So instead of taking medication, more drugs to treat your depression, your anxiety, there are things that you can do to allow you to live, and in essence also help you with your treatment, help you deal, help you matter. And those are the things that I want to focus on, that we're going to focus on, we're focusing on at Living for Hope. So, this is, once again, it just confirms my mission, our mission, because you're part of this, and I want you to get well as much as I want to get well. So stress management strategies and emotional and financial support strategies are becoming part of many treatment centers. Not only are they going to look at your care, your physical care, but they're starting to look at your stress management. How do you deal with stress and anxiety? How do you deal with your emotional, your spouse and your family members, your friends, your job, and your financial support? Like what kind of hit have you taken because of this diagnosis? Are you taking time off from work? Is it, did you have insurance to take care of you, or are you draining resources from your home? Like for me, I can tell you straight up front that finances were big stress factor in my life. I never went back to my original form of work, and so that took a big financial toll on my family. So these are all conditions that we talk about, that I will talk about for Living for Hope, and find new ways to deal with those tough issues that we're facing. So Carolyn Katzen, who's also an oncologist specialist at the University of Southern California, actually at UCLA, sorry, not the USC, but UCLA, she says that there's a revolution. We are becoming more wellness focused. And she goes, but we're not there yet. And we're in the middle of a shift. So there's a shift happening. There are people out there who know that it's not just the treatment, it's the whole. So we're going to focus on that here. So as you follow me, we're going to continue working on our mindset. We're going to continue working on how we can take care, love our body more. We're going to talk about how we can expand our support, through group support, through one-on-one support, through our community here at Living for Hope, and our spirituality. What does it mean to be spiritual? What is that higher power? Is that higher power, does it have the ability to actually help us? And I believe it does. It has helped me tremendously. So these are all the factors that I think, once they're in balance, they'll allow us to live. So thank you for listening, and please do pick up this article. It's in the Time magazine, November 7th, 2016. It's called The Forgotten Side of Cancer Care by Alice Park. And thanks for listening, and I will see you soon. Take care. Bye.